Hey, this is Mel with Gear Garage. I'm out here on the Middle Fork of the Salmon. I'm going to talk to you about what you should bring out here for medical supplies. First of all, it's important to have one major first aid kit. This has got your big supplies you're going to need. Some big incident happens. And then we've got our minor. This is what every boat carries, basic supplies you're going to need out here, just day to day, any simple things like Band-Aids. So we'll go through the major first. It's always important to keep these things in waterproof containers. This stuff has to be dry in case you need to get to it, time of need. So we keep these in big Pelican cases and then in separator cases. First and foremost, you got to protect yourself out there, keep yourself clean from infection. So we've got gloves in the pocket right outside. You're going to put these on for any incident involving body fluids. Next, we've got basic bandaging. We've got alcohol swabs. You're gonna need these to clean up wounds, clean it up, make sure it's clean of infection. And then Band-Aids of all sizes. You could go finger, or you might need something to protect a bigger scrape. And then we've got things for blisters and burns. We've got Moleskin. You can help someone on a hike. We've got Tegaderm patches, helps with burns. It's easy to do out here in the kitchen. Sometimes you touch something too hot. And then burn second skins. These are wounds that are gonna need protected during the day, and these things will keep you protected during time on the river. In this big pouch in here, we've got splinting and wound care as well. So first of all, you got a big wound, you're gonna need to irrigate it. Something like bleach water, boiled water, something that you know is clean to irrigate wounds. We've got Coban. This stuff is awesome. It's gonna stick to itself as you wrap it around. It's gonna stay on in the water. We've got an ACE bandage. This is good for basic sprains and strains. Say someone hurts their wrist, falls on it wrong, you can wrap this up. Keep it compressed, keep it from swelling. Got triangular bandages. These things are great. Splint up an arm, keep it stable. And then basic roller gauze. It's in a sterile package. Make sure you're covering your wound and keeping it clean. Got trauma shears. This is important. You need to cut some clothes off, get to an injury maybe, uncover the wound. Athletic tape keeps all the above things on your arm. And then a big CPR mask. You're gonna have a small one of these in your minors, but it's important if you're doing prolonged CPR that you can use one of these. Keep yourself protected again. Then we move over to this tab on this side. Got a bunch of things, kind of random. If you know someone's diabetic, it's important to have glucose on hand. They could become short of sugar. It's important to have that, give them. Got Benadryl. This is also kept in the minor kits. If someone's having an allergic reaction and they still have an airway open, Benadryl is the most important thing you can give them to stop that allergic reaction from happening. Got a thermometer. It's cold water out here on the Middle Fork of the Salmon. If someone's getting hypothermic, you'll at least be able to take a body temperature and start warming them up. Got Afterbite and Hydrocortisone. These are things that help with insect bites or maybe poison ivy. It's out here. Then in the next pocket, we've got extra sunscreen. Each person should definitely have a big tube of this, but just in case, we have an extra little tube. We've got chapstick with sunscreen. Again, sunburn your lips, they're super dry. They'll bother you the whole trip. We've got eye drops. These are important in case someone gets something in their eye, scratches it, you can irrigate it, clean it out. Then we've got tweezers. This came into use just last night. We had to pull a tick off somebody's stomach, so you can use those. It's also good for splinters. In our last pocket of the major kit, we've got some over-the-counter drugs that you can keep on hand to give to someone in a time of need. We've got aspirin. This is good if anybody has chest pain. You can give it to them immediately, and it can see if it would help. We have ibuprofen. This is a good anti-inflammatory. Anyone's got muscle pain, headache, anything like that, ibuprofen is good to keep on hand all the time. We've got Tylenol Extra Strength. This will help if someone gets sick, has a fever, or just pain. And then we've got a basic over-the-counter daily dose of a cold medicine. It's never fun to be sick on the river. We've also got a bunch of medicine that could help with gastrointestinal needs. So we've got anti-diarrheal. If someone gets sick, they're on the toilet all day, this could help alleviate that. We've got a laxative if someone having the opposite problem. We've got Pepto-Bismol, could help with indigestion, diarrhea, basic stomach pain. Then one last thing we have in our kit, because we have certified EMT and woofers on this trip, we have epinephrine. This is important. If you've got any type of allergies, go to your doctor. Make sure you get epinephrine on hand. This could help with a really serious allergic reaction with an airway closing. Last but not least, we've got a soap note. Just because so much is going on, it's a good place to keep your notes. You've got a pen in there as well. And make sure you write down everything that's happening, every drug you've administered, every type of care you've given. And that's the major first aid kit we've got out here. Next thing is every boat has a little minor kit. These are just things you can get to every day, anytime. Again, in a waterproof case. Keep everything dry. It's pretty basic. We've got athletic tape. You can cover up basic scrapes and bruises. Got a pocket CPR mask. Again, if you have to start immediate CPR, you're gonna want one of these to protect yourself from anything. Ibuprofen. Anybody needs this for sore muscles or headaches. And aspirin. Again, if anybody has chest pain, it's super good to get on hand right away. We also have Benadryl. Like we talked about before, great for immediate treatment of allergic reactions. Can reverse that, or you'll move on to your epinephrine. We've got bandages, basic, all sizes, and a triple antibiotic ointment, just to clean up that wound and kill all the bacteria. And of course, there was gloves. You'll always put those on first before you give care. And last but not least, we've got rehydration salts. These are great to keep on hand as well. You got somebody starting to get dehydrated, fall over the deep end, you can throw these in their water, pick them right back up immediately. So that's basic first aid on the river, and have a great day.